So thank you so much for attending, everyone. Today we are going to discuss about gallbladder stones, everything about gallbladder stones. So what are gallbladder stones? What exactly, why they happen? What are the clinical features? What are the signs, symptoms, and how to diagnose them? What is the treatment of gallbladder stones? That is what we are going to discuss today. So gallbladder stones mainly happen in whom? So according to the book, it says that 40 fertile fatty female, the patient who is in her 40 years of age, fertile, that is in reproductive age, fatty, that means some sort of obese female patients, they suffer more with gallbladder stones. This is what book says. But according to practice or practical things, so according to practice and practical things, these stones happen even in young patients, even in children, even in old patients, diabetic patients. So we are seeing in our practice like these are present in almost all ages, like young age to old age. So the thing is, one, Western lifestyle, processed foods, diet, junk foods, sodas, cool drinks, and sugary drinks, energy drinks, then no proper workout or sedentary lifestyle. So this is what is creating more fuss in the gallbladder, which is leading to gallbladder stones. So why gallbladder stones happen? Whenever we eat food, the food has a lot of fatty material, fat. How does these fat lobules digest in the digestive system? The bile which is present in the gallbladder, what does gallbladder do? It pumps bile out of gallbladder. Then what happens? That bile goes and digest these fat lobules. So the gallbladder bile, the bile which is present in the gallbladder or which secretes from the liver, helps in digesting the fatty lobules which we eat, because the lobules of fat are larger in size. They have to be broken into pieces to get better digestive process. This is what done by bile. So the bile is secreted from the gallbladder. Now, if there is cholesterol deposits present in that bile, then that cholesterol deposits get super saturated with that bile and converts into gallbladder stones. So why does cholesterol increase? It may be because of our diet, processed foods, junk foods, or if the cholesterol is present high in the blood, this cholesterol deposits in that bile, accumulates and becomes supersaturated and forms stones, gallbladder stones. This is the pathophysiology. Now, there are different causes for gallbladder stones. No proper timing of diet. Timing of diet or ingestion of food is very important, because gallbladder prepares, or gallbladder has some circadian rhythm. According to the food, it prepares when to contract. So if you have same type of timing, similar timing every day, according to gallbladder circadian rhythm, it contracts at the same time. Now what happens? You have taken food or diet for 1 week at 7 p.m. Now you have shifted immediately from 7 p.m. to 10 p.m. or 11 p.m. Now all these days gallbladder was like acclimatized to secrete bile or to contract at 7 p.m. Now, because of change in circadian rhythm, it again contracts at 7 p.m., but there is no food, no diet present there, because you are eating at 10 p.m. What happens? Bile secretes out. Bile secretes out of the gallbladder. Now, there is only little amount of bile present in the gallbladder, but there are a lot of cholesterol deposits. This small amount of bile and cholesterol becomes supersaturated in the gallbladder and forms gallbladder stones. This is a clear pathophysiology. So that is the importance of timing of diet. Sugary drinks, processed foods, all this again increases cholesterol levels or increases the fatty lobules like processed foods have a lot of fat. These lobules to secrete bile, gallbladder functions more, which leads to more secretion of bile than formation of gallbladder stones. Now, what are the symptoms and signs of gallbladder stones? People may have epigastric pain, gaseous distension, bloating, acidity, chest pain, right hypochondrial pain. Pain will be at the right side of the, just below the chest, right side. That is right hypochondria. So this pain is quite common in gallbladder stones. Now sometimes if the gallbladder stones come out of the gallbladder and they may sometimes struck in the ducts there, this may lead to obstructive jaundice. So these are the signs and symptoms. Some people may have fever as well because this gallbladder stone may create inflammation there, which leads to fever. What is the diagnosis? How we diagnose? One, signs and symptoms and clinical examination is very important. Then ultrasound, abdomen and pelvis is the gold standard investigation for diagnosis of gallbladder stones. Now, if we detect gallbladder stones, there are different strategies. If the patient doesn't have symptoms, they may not undergo for surgery. But most of the time, after 1 year or 2 years or some years, after some years, they may get complicated because that gallbladder stone may come out of the gallbladder and may struck in the CBD ducts or any ducts there, which leads to obstructive jaundice. This is why we advise laparoscopic cholecystectomy for most of the patients. So, laparoscopic cholecystectomy is a simple surgery. Within 1 day, patient can be discharged. There is no major scar, just 1 centimeter scar and 2.5 centimeter scars. So they don't even know that this operation they have underwent this operation. So in diabetic patients, most of the time, these gallbladder stones may get complicated. So we advise for laparoscopic cholecystectomy. Some young patients, they have gallbladder stones, but if they don't have symptoms, sometimes we don't advise surgery if they are not creating any disturbance. But if they have symptom like acidity, chest pain, something like that, it's better to get operated laparoscopic cholecystectomy. What are the complications? As I have already discussed, obstructive jaundice is one of the major complications. CBD duct stones, the gallbladder stone may get stuck in the CBD ducts. And one more complication is pancreatitis. This gallbladder may go into the ducts of pancreas and it may create inflammation there, which leading to acute pancreatitis episodes. Sometimes, rarely, there may be intestinal obstruction because of this gallbladder stone. This gallbladder stone can go and get stuck in the intestine, which leading to intestinal obstruction. These are the complications. So the main gold standard treatment for gallbladder stones is laparoscopic cholecystectomy. If someone is suffering with gallbladder stone, if someone has diagnosed with gallbladder stone in ultrasound, just don't wait. Just don't get complicated with these obstructive jaundice things and cholangitis type of things. There's a simple surgery, laparoscopic surgery, even robotic surgeries we are doing now. So everything is covered under insurance. So please don't wait for complications. If you get operated, you may, like, your lifestyle may improve. You will suffer for like years together with acidity, bloating, indigestion type of things, but people won't get operated. They are feared of operation. But as of now, operation is very simple because of technology and equipments available. So we do laparoscopy and robotic surgeries here for gallbladder stones. So if someone is suffering with this type of problems, and some may think that if we remove the gallbladder, how will the digestion happen? The bile is secreted from the liver, not from the gallbladder. Bile is secreted from the liver into the gallbladder. Then gallbladder will contract, then bile will come out. If the gallbladder is not there, what happens? Now the bile will secrete from the liver. It will go into the intestine directly. So whatever we eat, the food we take that goes into the intestine. Now from the liver, the bile goes into the intestine and digests the fat globules. So it may take some time, like 1 or 2 weeks, for the body to get acclimatized. But it doesn't mean that gallbladder helps. Gallbladder only helps for digestion. No, it is not that way. It is a liver which produces bile. So don't worry about removal of gallbladder. It is very simple, easy procedure. Nothing to worry. It is like a 1 day procedure. Like now we are doing like daycare. Nothing to worry. Your work will not be disturbed. Will not have any problem. It is not complicated. Simple. 1 day admission, surgery. The next day afternoon discharge. So people who are suffering with gallbladder stones, surgery, laparoscopic cholecystectomy is gold standard. So if someone is suffering with this type of disease or problem, I am there always at Onus Robotic Hospital, all branches, Uppal, Champapet and Tukkuguda. So you may contact our customer care team. Anytime they will respond. You may take my appointment and you can reach me. Thank you so much. Signing off, Dr. Raghuteja, laser, laparoscopic and robotic surgeon, Onus Robotic Hospital. Thank you.